Now I just would like to welcome everybody to our second Coffee with CAP. On behalf of the CAP board and staff, I would like to thank you for taking an hour out of your busy schedules to listen, share, and network with other out-of-school time providers. Today's Coffee with CAP focus is on reopening programs. Whether your program intends to provide summertime programs in person, virtually, or in a blended mode, we hope that today's discussion will be helpful in providing additional ideas and resources. To begin our discussion today, I would like to introduce Maxine Quintana. Maxine is the Director of Out-of-School Time Initiatives for Denver's Office of Children's Affairs and co-founder of the Denver After School Alliance, a network of after-school providers. The Denver After School Alliance is working to ensure Denver's children and youth have both virtual and in-person access to summer programs during the COVID-19 pandemic. Maxine, thank you for joining us today and sharing the Denver Planning Toolkit.
You're welcome. Thanks, Valerie, for having me. Hi, everyone. Good morning. Thanks for taking time out today. Wanted to let you know that we too are developing some resources and creating some space for providers to come together to talk about the issues that are happening across our country right now. So I'll be sure to share those with you as well. So the Denver After School Alliance is an intermediary organization that works at the city and county level in Denver. So we're very, very similar to what CAP does, just at the city and county level for Denver. So what we wanted to do for once all of this COVID started happening, we did a couple of different things. One, we wanted to really understand the landscape of who could have programs in summer and who couldn't. And so if you go to our website, and I didn't prepare a presentation for you guys, but everything is on our website, and I think you just Megan just put the toolkit up. There's also a data snapshot, and that's really where we started, is trying to get the lay of the land of what was happening across our after school field and what was intending to happen for summer. And the hard reality is that so many of our providers are dependent on other people's facilities that the only organizations that are able to offer in-person programming right now are those that have their own facilities. So it's your big dog organizations like your Boys and Girls Clubs, your Ys, Girls Inc., etc., because they own their own facility and they can program out of them. We wanted to start preparing organizations for coming back, and so we developed a toolkit, which again, that's what Megan put up. There's a lot of other great resources on our website as well, that really has the latest and the best information to help providers think about what reopening could look like for them. And what we wanted to do was link to national tools, to local tools, to statewide tools, and have everything is just sort of in a one-stop shop, so that providers wouldn't have to be searching through and digging through all of the guidance that was out there and available, but it was in one easy place for them to find. We update the COVID toolkit. Honestly, we were doing it twice a week. I think we're about ready to move down to once a week. We do it on Wednesdays is our day. So even tomorrow, we're going to be adding some new tools and resources to help organizations really see what this looks like. Right now, we're really trying to focus on creating videos so that people could see what it can look like in action. And so that's one of the new things that you'll see tomorrow. In addition to really focusing and supporting the very few summer programs that are going to be open this year, because frankly, that's the reality. Although we're still advocating for spaces for July and August, whether it's open programming that happens in parks or if we're in the bottom of a church facility. I mean, we are still looking for some facilities and helping to advocate for those organizations that want to and are willing to program in person. With the move to the virtual programs, there's a whole section in the toolkit that is really focused on best practices and how to deliver a virtual program. Everything from starting to, geez, how do you use Zoom, right? So we created a lot of professional development resources and opportunities. We also created an assessment tool so that you could measure the quality of virtual training. And so all of that is in the toolkit as well. So the toolkit really is that one place where all the information is housed so that providers can find information quickly and easily. We're keeping it very up to date as we can. We also put together a resource list for families with offerings from about 70 different organizations who are doing virtual programming this summer. That's also available on our website. The other thing that we have on our website that would be helpful is we recorded several of our COVID-19 related trainings that people can go back and refer to. And if you're really interested in in-person programming, I would highly recommend going and viewing the Coffee and Conversation conversation that we had with the Y and Denver Parks and Recreation. Both those organizations are running emergency child care services, have been running emergency child care services for the last few months. And it was a fascinating conversation about all the little things that they've put into place, whether it's using hula hoops to space out kids, whether it's using noodles as kids walk, so that they could, make sure that they have distance in between. But they really just have an open and authentic conversation about some of the challenges, some of the practices that they put into place as they've been doing emergency child care programming. And so I would just highly recommend, you guys are welcome to use the toolkit. It has a lot of good information that's relevant to all communities, right? Because it's really intended to be that one-stop shop of resources for providers. And so, not sure if that's what you wanted, Valerie, but that's what you get from me this morning, and I'm happy to answer whatever questions you guys have. And like I said, we just have a ton of resources up on our website, and more will be coming, and we're keeping it as up to date and current as we can, and it's available for everyone. Oh, I can't hear you at all. Val, I can't hear you.
Okay, can you hear me now?
Yes, thank you.
Okay, perfect. Thank you, Maxine. That was exactly what we wanted you to share out to the group today. And there are many valuable resources on the Denver After School Alliance website, so please take a look at that. And right now, are there any questions on the call that you would like for Maxine to address?
If you do have a question, feel free to unmute yourself and ask it to the group.
Okay, I'm not seeing any in the chat box or hearing from anyone. So I thank you again, Maxine. And at this time, I would like to share out about the information that is on the Colorado Department of Education's website. Megan's going to share that link in the chat box, I believe. And there we go. And Dana Scott had hoped to be on the call today, and this morning, as with everyone, emergencies occur and she could not join the call. But again, she also wanted to share with you that this is a resource on the Colorado Department of Education's website, and that, but like even with the Denver After School Alliance or any of these, to please check into your local, whether it's county, city, or your school district for their guidance on reopening. And with that said, I'd like to introduce Stephanie Hanson, who is with the Adams 12 School District. Stephanie is the Peak Learning Center Director for all federally funded 21st Century Community Learning Centers for Adams County. Stephanie also serves on the CAP board. So Stephanie, are you with us?
Yes, I'm here.
Okay.
So I was asked just to speak a little bit about the status of our programs here in Adams 12. I can tell you that our 21st Century sites will not be opening for in-person at this time. There are some potentials later in the summer, but as of right now, we are not. I can tell you that our Adams 12 base programs will be starting servicing kids the week of June 15th. And a limited capacity. They won't be at all of their locations, and they also had to scale down the number of hours a day from 8 to 4 rather than a 6 to 6. I can tell you that the primary reason why Peak decided not to open is because of that 10-to-1 ratio was going to make it really cost prohibitive for us to serve a decent number of students, and our current outreach efforts were pretty successful, and I just felt like we were in a better position to continue to serve more kids and serve kids well in the virtual format. So I can also tell you that we were well positioned when this all started because we already had an online format for our academic component. So our kids engage in Myon and Imagine Learning, which are already it's already a web-based format that we were able to continue. We had to get really strategic and smart about how we progress monitored, how we communicated with kiddos, and how we conducted outreach with families. It has not been seamless and it has not been without its challenges, but we are feeling pretty confident that we're able to continue in that way. We are also going to start doing a lot more engagement based on some of the resources that have been shared out on the CAP website. We're doing Zoom meetings with our kiddos. We're still meeting in person in small doses at our mobile distribution meal sites. We're able to make connections with our kiddos. We're surprised at how much we're still able to onboard new kids. Families are still reaching out, and even though we are in that virtual format, our kids really just need a safe place to be able to connect with one another, build relationships, and just stay connected. So that's been our primary focus. We will be doing some virtual field trips, lots of those kinds of creative endeavors. We still do our coding activities. But really, for me, this is, there's a real push also to continue to provide academic supports for our kids. But right now, we're just trying to stay connected and let our kids know that there's people out there who still love and care about them. So that's sort of the status of Adams 12. I don't know if that sort of helps what you were asking for, Valerie.
Yes, we just are trying to get a snapshot of what's going on around not only the metro area, but we hope maybe there's some rural providers also on this call that could share out any questions or lessons learned that they have upon reopening their sites. So are there any questions for Stephanie or anyone that just wants to share about what is happening in their own program site? Okay, I'm not hearing any questions, so I'm going to thank you, Stephanie, and I'm going to go on to Amber Stowe. Amber is the supervisor of the Foothills Park and Recreation Children's Programs. Just yesterday, Amber and her staff opened up their summer camps. Amber also serves on the CAP board. Amber, could you share how yesterday went and anything that you can share as lessons learned as you prepare to reopen?
Sure, Valerie. Thanks for having me, and I appreciate you giving some space at the beginning to everything that's going on in the world today with the protests, and I just really appreciate you giving some room for that this morning. I did want to just let you know, typically, so we, as Maxine said, we are in our own facilities. We typically partner with Jeffco schools as well. So normally in the summer, I provide 11 different summer camp locations, and we typically have 1,100 to 1,200 students enrolled in our programs. We were not able to partner with Jeffco schools this summer, so we are only running programs in our recreation centers that were already licensed to provide care. So that already drastically limited the number of kids I could provide for, as well as the new, the group size of 10 capacity my rooms that I typically can have maybe 23 to 27 kids in, now I can only have 10. So my capacity this summer for school age kids went down to 156, which is incredibly different. So like I said, we operate in Jefferson County, so we've been really trying to pay really close attention to the county guidelines that have been put out, but also then the state guidelines and the CDC guidelines. And I think like Maxine said about updating her website constantly, it's like keeping up with those changes and how do you implement programs under those constant changes. We initially built committees across my team, and there was a safety and health committee, there was a planning and curriculum committee, there was a staffing committee, there was a wellness checks committee. And so each little group of people put together plans about how we were going to reopen and do each of our policies and each of our procedures based on the highest level of either requirements or recommendations by the county, then the state, and then the CDC. So we put all of our plans together. We built our guidebook for how to open and operate, and then we started enrollment. And I would say that, I would just add to that too, we also have a couple of preschool programs here, and we opened those as well. So we're looking at early childhood kids also. And I think some of the kind of the biggest challenges when we were starting to reopen is that not only do we have these requirements, recommendations, but then I have viewpoints from staff members and parents and families about how we should operate. So I put together like, this is how we're going to run based on the guidelines and the recommendations, but then I would have parents coming to me saying, well, you can't make my kid wear a mask. And I was saying, I'm not going to make your kid wear a mask, but it's a recommendation that they do. And staff coming in and saying, if you don't make those kids wear masks, I don't want to come back to work for you. And so I was feeling like it was just coming at us from all angles, just in the prep piece. But we finally got through last week, staff training primarily through Zoom, big Zoom meetings, and then very small groups coming into the centers, preparing their classrooms, getting them open. We took a very conservative approach to, right, we have 10 kids in each space. We are trying to primarily put family members together when possible, but also each classroom is really kind of age-based. So we have like our kindergarten classroom, our first grade classroom. Right now, I think I was gonna say we were gonna have 20 classrooms up and running. I think I have 17 because we had a little bit lower enrollment than we had planned for. We are doing the curbside check-in process and taking wellness checks of all employees and staff before they come into the facilities. So that's really the biggest new piece of kind of how we're operating. That's very different. And then trying to put a lot of focus on, well, if the teachers never see the parents, how do we communicate with each other to let them know all the great things that are happening in our programs, and all of the, if there's a challenge, how are we going to handle that communication? So we had to think through, and that ended up becoming a committee, a parent communication committee, and how are we going to make sure that that's happening? So we opened up the preschools a couple of weeks ago. A lot of parents were fearful, or they already had other arrangements made. So we have more preschoolers coming back now, but I would say yesterday went really smooth for the most part. And it was really nice to see kids and smiles and excitement and joy, and the wellness checks really went off like a breeze. Nobody really complained. They all are kind of now in this like, we expect it. I would say we had one classroom out of the 17 that successfully managed their mask wearing most of the day. But I would say that most of the others, the kids, the masks came off, the staff struggled, they're not forcing in any way, but even just the encouragement, kids are like, I'm over it with the mask. So gosh, I think overall it was a success. We're on day 2 now. We've already worked out some kinks. And I think that the continued challenge now is because we are in a park and recreation district facility, these changes are continuing to come, and the governor put out orders for park and recreation district changes now that it's in a draft format. But whether playgrounds are going to reopen and pools are going to reopen and what's coming next and how are we going to keep up with it. And I have to just keep telling my staff, like, don't start, don't change, don't do anything different until I tell you, right? Like they're like, I heard the new order about the virus doesn't stay on playground equipment. And I'm like, okay. Like they're just all coming at me all the time. And so it's It's interesting, it's different. I hear staff saying, you know, it's sad that they can't do things how they used to, but I think everybody's pretty happy overall. Parents were happy overall, and it's just a lot, right? Summer camp is always a lot, but now I have way reduced numbers, and it's just still a lot, just to keep up with all of the craziness that we have to do things differently now. So that's kind of it. I was all over the place in my sharing, but I'm happy to talk with anybody about any questions or ideas. All the brainstorming we've gone through about every little detail, from setting up our classrooms to taking temperatures in the middle of the day to hand washing checklists to anything that you guys are interested in. I have a lot of resources, and I'm happy to talk with anybody.
Well, thank you, Amber. One of the I taught kindergarten years ago for 10 years, and all I can think about is how touchy-feely and everything. So how are you going about the social distancing and that with this, you know, with little ones?
Right. I feel like it's really a challenge, and we are just now implementing things to try it. But so just in the kindergarten classroom, as an example, there's 5 tables, 5 6-foot tables in the room, and they're spread out, and the staff put a piece of tape down the middle of the table, and they have a child sitting at each end. They made buckets for every child. So every child has a bucket of their own, like crayons and markers and a bag of Legos and a bunch of toys, different things for each child. So when they come in the morning, they grab their own bucket. They have their own things that they have every day to play with. And at the end of the week, the staff intend to take out some of those things, sanitize, and then reorganize so new kids can have those different toys. So they'll change it up each week. The kids, for the most part, sat in their spots, and staff did kind of staff-led activities. They had the kids get up and sit in different spots on the floor so they could do story time. But I mean, kids are kids, right? And you can't keep them all in a line to go outside 3 to 6 feet apart. Like, so, you know, they get close to each other. We've taken an approach of, right, this is now our new germ family that's in this classroom, and we know we are going to breathe on each other sometimes, but for the most part, you know, we're trying to, you know, encourage that we're not doing games where they touch each other a lot. We're not sharing toys where they're all like right on top of each other. I don't know if anybody has done electronics in their program, but like, you know, you see a kid bring out whatever their tablet is, and like all the kids are on them, like, I want to see what you're playing. So, right, those tables and the way they're set up, it's kind of like everybody plays with their own things. We've let the kids bring more of their own things. Usually we're really discouraging about, don't bring your own toys, don't bring your own books, like we don't want your things to get lost. And we've had in the parents, we say in their emails, right, like, add some toys to your child's bag, add some of their favorites, add their books, and they can play with their own things at their tables. But I mean, we're just trying to play games that keep them apart as much as possible. We're doing a lot more hand washing, a lot more sanitizing. And we just know they're kids, right? Kids are kids. And they're going to get close to each other. We just are not encouraging hugs when we see like friends see each other for the first time yesterday that they haven't seen each other in months. And it's like, okay, we do air hugs and stuff like that. Air high five. Trying to, you know, do our best.
Well, thank you, Amber. Are there any questions for Amber?
I have a question for Amber. I'm Denise. Since your enrollment is down, did you have to like limit any of the enrollment, like the process on who can enroll and who can't?
Yeah, that was a real difficult decision, Denise. And you know, it's been really interesting that that's been kind of a shocker for us. So when we opened enrollment, we thought long and hard about what was the best way to do that. And typically I have about 425 kids that come to my programs year round. They attend all summer, all school year, and we decided that the very first thing we were going to do was open up to those families. And in my language that I was opening up enrollment, I really encouraged it to be for essential workers, first responders. I didn't mandate it, but I said, please allow room for these families to enroll first. And then once that first set of enrollment came in, then I said, anybody else in this first set of priority families of our year-round families that wants to sign on, now's the time. Then we opened up to all of our prior users, which was anybody who'd used a summer camp before or before an after-school program before. and kind of did that same language, right? Please save room for this. But I think Stephanie talked about this, like the budget piece, like that's still a struggle for us. We really expected all 156 of our slots to be gone immediately, but because we took such a conservative approach, we're not, in Jefferson County, we're really following this recommendation of trying to keep groups of kids together as much as possible. So we're not allowing a lot of kids to kind of come and go, multiple schedules, drop-in options. It's really like, if you need care, we felt like that was the safest way, is like you sign up and you're in and you're staying with your same group all summer long. That didn't work for some families. Like a lot of families that are used to our programs just want part-time care. They want to just come and go all the time. And I just didn't feel like that was safe for what our county is recommending. So I think that kind of limited us in terms of how many families came. But then, right, my budget is really tight because I was thinking I'd have 156 kids here, and I have 90 coming for school age. I think I got off track from your question.
No,
Denise,
that was fine. No, I appreciate it because we just, and I don't know if we have that control. I know I see some of the people that on the meeting here that could probably answer that for our district, but to limit who can and who can't enroll, I don't see that happening for us, but it might. So, but I appreciate it. Thank you, Amber.
You're welcome. I do think that Boulder Valley School District did another process where they had like an application process for families that had to submit. And I mean, I think you could look at their website and see they really prioritize like first responders, maybe single parents, healthcare workers, and they had an enrollment process that really limited. And I think the reason they had to do it that way is because the care that they provide, we are pay for service, and I think what they were providing to their families was more of a free service, so they had to really be more restrictive. And I evaluated their process a lot, so that might be another place to look.
And I know, you know, in Adams 12 for our fee-based childcare licensed school age programs, you know, they did a lot of surveying with families, and obviously, you know, with shrinking the number of hours and all of that really did address some of those issues, but they did a lot of work ahead of time in engaging with families, trying to figure out what it was that would meet their needs, and then just being really transparent about what we can and cannot do. For me in 21st Century, the other challenge we had was that we were having significant bond construction in our district. So where I typically have 9 sites, I was already going to be down to 4. And that challenge of picking who was going to get a spot and who wasn't, at this point, I just couldn't bear that. So Amber, one question I have that I think is a particular challenge for school agers also when we talk about budget is because typically you're able to have a lead and then a support person. And then in this format, you're paying for all leads, correct?
I am. And yeah, I think that's another challenge, right? Like, so I think in school age care, we're always used to, you're never alone with a kid, right? As a staff member, you always have 2 staff members, always. And we have set ourselves up that we have 1 staff member in each space. Now, the way our facilities are designed, depending on which space it is, there's always a staff member that's very close by, right in the room next door. There's partitions, there's glass partitions, there's all kinds of varieties of things that we have in 3 different locations. So yeah, it's a group lead in every space because they have to be. We also have group leads working as our health check people that do the check-ins in the morning. And that way, if we do have someone who needs to be out on a day, we can easily put that person who's already kind of come into contact with those same families because they're the health check person, can move into the classroom, and then I can move a non-group lead person into that health check spot for the day. So we had to think a lot through like that subbing process. And yeah, that does impact the budget greatly, but I have 1 person with each group of 10 kids. So as supervisors, we're doing a lot of running too in terms of bathroom breaks, and we have phones and radios in place in case they need something or a kid has an issue, then we can run down and support. So we have a lot of that kind of, we also have cameras in all of our spaces, which is a little unique. But we felt like that was supportive of the staff. So that they had that backup if we ever needed to say, you know, like, I think my biggest thing to say to staff is never put yourself in a position where it's your word against a kid's word and it's one-on-one, but at least we have that camera backup as a support for them. Somebody also put a question in the chat box about, did you use any large spaces like a gym? And we did. We have 3 of our spaces are large, like a gym, and they have multiple groups. So in those large spaces, it's gigantic, right? But we've only put 2 groups. So we have 1 group of 10 on one side and 1 group of 10 on the other side. A couple of those spaces do have a large curtain that can go down in the middle, and that's helpful. But we also thought it might be helpful if we need to pull it up, that we could have an aide on one side and a group lead on the other if we get to that point. But it's interesting, it's working. We did end up deciding to use rugs in our spaces. After talking with licensing, they talked about, you know, if you have a carpet in a space, it's the same as a rug in a space. So we have put in some different procedures to make sure we're kind of spraying down the rugs each night, but it helps warm up the space to have a rug. We also put some big tablecloths under tables where we're doing arts and crafts projects, because my facility staff do not want any glue on their gymnasium floors. Like, you have to be so careful. We did end up pulling in some of our chairs from our lobby furniture in our rec centers. We have like this perfect, like, hospital grade vinyl lobby furniture that's not super comfortable forever, but it's easy to clean when multiple people sit on it. So the kids have like a nice big comfy chair each. There might be 1 or 2 chairs in each space, so we have an easily cleanable chair. One staff member brought in, I don't know if you've seen those big round kind of papasan chairs, but he told each family, please bring in your own twin size bed sheet. And so the kids get the chair for a half a day when they get it, and they put on their bed sheet over the chair, and then they can sit in the chair, and it's kind of like an award that they get to use the chair for the half of the day, and they take turns on the chair, but they cover it with their own sheet. They've gotten really creative, but that's warmed up those gym spaces a lot, made them more cozy. And then we had to set up, you know, tables along the side with all of our materials, and then thinking about how do you store away the stuff that's like the cleaning supplies, because we needed in all the space to lock it up away from the kids, and we've gotten creative with that. And then we also had to get pretty creative with bathroom rotations, because there's not a bathroom in our gyms, but there's a bathroom right outside. And so we take this group of 10 and do bathroom breaks, and then we take this group of 10 and do bathroom breaks, and then we have sanitizing staff that come in and clean the bathroom after each group. So it's a lot of thinking through logistics.
Thank you, Amber. This is Kayla Ball, by the way. I work with the Jeffco school age programs, and we are not operating for the summer because we're in Jeffco buildings, and Jeffco buildings are closed. But that's been our biggest challenge, is we have not seen, we operate out of gyms and cafeterias. We have very few small classrooms licensed because they're in use in school buildings for classrooms. So that has been our biggest challenge in trying to figure out how, when we do reopen, what does that look like with those large spaces. So that is really helpful information, kind of seeing what it's like, because right now they're giving you that 36 square feet per child, but still maintaining 6 feet between each child. And if you do the math, it just doesn't make any sense. So I appreciate the kind of visual of what that looks like in a larger space.
Yeah, you bet, Kayla. And anytime, like if anybody wants to try and FaceTime with me, I'd be happy to kind of show you around the rooms with my phone or an iPad. And so you could see kind of how it's set up, or share just some pictures with you via email so you can see the setups, whatever would be helpful.
That would be great. Thank you. I have a meeting with our central team after this, so I'll definitely reach out to you. I think you know my supervisor, Kathy Lytle. So
yeah.
So I got this call today. So I think we'll see that. But yeah, I think that would be a great thing. Thank you so much.
You bet.
Amber, I'd really be interested in seeing some of that footage as well. I think that's one of the things that we're trying to do, is bring together footage from different organizations and package it in a way to, one, not only help providers see what it could look like, but then 2, to make parents see what it looks like, to help hopefully alleviate some of their concerns and fears about what programming looks like during this time. And so we'd be happy to help show some of that stuff as well. And we're, like I said, already working with the Y and some other organizations to bring together some of that footage into a nice compilation that we can then share out to, again, providers and parents.
Yeah, I agree, Maxine. I think one of my like big ideas that didn't come to fruition based on timing was to have like mini Zoom meetings with the teachers in each room and the parents, and have the teachers in the room showing on Zoom, like, here's where you're going to come and here's the centers, and just kind of like a tour that you would do, or a parent orientation night that you would do, to say, right, it's going to be fun and it's going to be cozy. And like, I think a lot of parents were really fearful that their child was just going to only be able to sit at one desk, like they see those videos of like the graduation ceremonies, right? Like, how is my child going to even get to talk to anybody? And so that was one thing that, I mean, just timing, we wanted to get reopened for the community. And if I would have had more time, I would have loved to do something like that. Instead, we ended up doing bio photos via email, where staff took a picture of themselves, wrote their bio, and we included that in an email. We did have a couple of families that reached out, and I brought them in the day before we opened just for a tour. And I said, you know, it's just going to be me and you and your kiddo, and we can go see the classroom. Please wear your masks and we'll walk around, not touch anything. And that really helped those kiddos that, I mean, you know, you have those kiddos, right, that they're just not going to do well at drop-off time and transitioning away from their families. And that really helped those kids have a great first day.
Okay.